All right. Good morning. Hi, I'm Andrew Jones of LKC Technologies. We're here on the exhibit hall floor of the American Academy of Optometry meeting here in Boston. I have here with me Justin Schweitzer. Before we get into our discussion with Dr. Schweitzer, I just wanted to kind of talk a little bit about electroretinography. Now, what you're aware of in terms of ERG is what you learned in school. Big devices, uncomfortable for the patient, uncomfortable for the technician or the practitioner. Well, we'd like to talk to you a little bit today about a handheld ERG device called the Retival, which makes it so much easier to do ERG in your practice. So like I said, I have Dr. Justin Schweitzer here with me. Thank you for joining us. Dr. Schweitzer, tell us a little bit about your practice, kind of where you're from, and kind of familiarize us with your practice.
Yeah, so I'm an optometrist. I practice at Vance Thompson Vision in Sioux Falls, South Dakota. We're an OD-MD collaborative care practice, and about 60% of my day is managing glaucoma patients, and the other 40% or so is managing anterior segment disease, whether that be preparation for cataract surgery, preparing patients for glaucoma procedures, just managing anterior segment disease. So I love what I get to do on a daily basis. It's a fun place to work, and have just enjoyed working with the ERG that we're going to talk about here in a little bit.
Excellent, excellent. So Dr. Schweitzer, where do you use your Retival in the practice?
Yeah, so for me, where it's most valuable, because we don't do retina in our practice, we're an anterior segment practice, is the glaucoma patient-based population. And so I think of glaucoma like a very large puzzle. There's a lot of pieces. We're really trying to assess risk for our glaucoma patients and decide what patients should we watch closer, which patients should we treat. And the beauty of the Retival and ERG is that it's another piece to that glaucoma puzzle to be able to make decisions for our patients, which I know we're going to get into more here in a little bit.
Excellent. Now, with the Retival, what protocol do you use? What test protocol do you use when you're looking at your glaucoma patients?
Yeah, so I use the photopic negative response 3.4 hertz long protocol when I'm doing it, and it takes about 60 seconds per eye, which is nice. It doesn't take a long time at all. And when you look at the footprint of it, you have it in your hands, very small. And so the beauty of it is I leave our patients in the room. We don't have them leave the exam room. They sit in there. My technician comes in and performs the test, 60 seconds per eye. We're done, and I have what I need.
Excellent. And what are you looking for when you look at the results? Kind of what are you looking for in terms of the ERG?
Yeah, I mean, that's the beauty of it. It's not hard to interpret it once you do a few of them. Once you understand what you're looking for, it's very quick to interpret it and educate your patients on it. I'm really looking at two things. I'm looking at response time, or the implicit time of the retinal ganglion cell layer. We know in glaucoma that the retinal ganglion cell layer matters in glaucoma now. We know that it is damaged, and it's damaged early in the disease process. Not for every patient, but it's part of glaucoma now. And so the response time, or implicit time, is telling us how much stress is being applied to that particular layer. So I want to see if that's reduced or a slow response time. That's concerning to me. That doesn't mean I'm going to necessarily treat, but it's a red flag of concern. And then the other thing I'm looking at is the amplitude. And that's actually looking at damage to that retinal ganglion cell layer. And if there's damage, obviously that's a problem as well. And the key with glaucoma is we're trying to catch things early. We're trying to make sure we're making proper diagnoses, but also bringing patients back in a timely fashion.
Excellent. Now, how do you use the data? If you see something that's concerning, I mean, how do you utilize that data in treating your patients?
So it depends on the situation. If it's a patient that is a glaucoma suspect or ocular hypertensive, where I haven't diagnosed them with glaucoma yet, we run an ERG on them. We look at all the other pieces of the puzzle. We're looking at, obviously, the retinal nerve fiber layer. We're doing a visual field. I care about their pressure, their corneal thickness, assessing that risk. And then I get a test back like the Retival ERG, and the implicit time, the response time, is low. Does that mean I'm going to treat that patient? No, but instead of waiting maybe a year to bring them back, I'm going to say, hey, let's get you back in 6 months. Let's repeat these tests. Let's repeat the Retival ERG as well. And let's see if there's a change in any of that. And so it allows me just to be in front of what we're trying to prevent, which is damage to their visual field, damage to the retinal nerve fiber layer, so it stays out in front. If we're talking about a patient that's already diagnosed with glaucoma, I utilize it in a little different way. In those situations, I already know they have glaucoma. They've already been diagnosed with it. But what I'm trying to assess is the risk of them progressing or continuing to progress. This, again, can help me. It's a piece of the puzzle. I can look at, number one, implicit time. Is there stress being provided or stress on retinal ganglion cells that are not damaged yet? We know some will be damaged, but that are not damaged. And then the amplitude how damaged are those cells.
Sure.
And so that's how I use it in patients that have glaucoma.
Okay, great. Thank you. You mentioned a little bit before in terms of practice flow. Where do you fit this into the flow? You mentioned you take it to the patient and do the test in the lane?
Yeah, I mean, again, the beauty of it, you look at it, the footprint, it's tiny, it's small, it doesn't take up a lot of space within your practice. And so the way that I do it is I don't order this on every single one of my glaucoma patients. I utilize it strategically. I think glaucoma is a very artful eye disease, how we treat it and how we order tests for it as well. And so I order it when I feel like I need it to help me make a decision.
Sure.
And all I do is I tell the patient I want to get an additional test. They stay right there in the exam room. They don't leave. My technician comes in and performs the test, 60 seconds per eye, and we're done.
Excellent.
And then I go in and talk about the results.
Excellent. And how do your technicians like using the red vial?
Oh, they love it. They love it because it's an easy thing to do, right? Once they're trained on how to use it, where to place the strips for the electrodes, how to utilize it, it's quick and easy. And the time, it doesn't take a lot of time. As I mentioned, 60 seconds per eye.
Great, great. Well, Dr. Schweitzer, thank you so much for joining us today. I wanted to thank everybody for joining us on the live stream. We have one more live stream later today, actually two, sorry, one with Dr. Simbor this afternoon and then a student focus session at 4 o'clock. So once again, thank you very much for joining us. Thank you very much, Dr. Schweitzer. And have a great day.
Thanks for having me.
Thank you.